Hi, good morning. I'm Dr. Lin. How would you like to be addressed as?
Hi, Dr. Lin. I'm Steve John.
Steve, where are you from? Do you have your health insurance card?
I'm from the United States. Here is my health insurance card.
How long have you been in Kaohsiung?
I have been in Kaohsiung for 5 years.
May I ask, who is accompanying you?
Oh, this is my wife. She's a citizen of Taiwan.
What is the purpose of a visit for today? How may we help you?
I have been struggling with back pain recently.
Where is the location of the pain?
A low back, right here.
What is the character of the pain? Is dual or sharp?
Very dark.
Was the pain sudden?
It did.
How long has it been since the pain began?
For around 3 months from now.
Has the pain progressed in terms of intensity?
It seems to getting worse.
In what kind of circumstance was the pain elicited?
I can't recall properly, but it seems to be related that one time I have been down to lift something. So I have been hurting ever since.
Are there any other accompanying signs? For example, is pain or numbness traveling down the leg?
None.
Is there any motor weakness?
No.
Is there urinary or defecation function affected?
Normal.
Is there any exacerbating factors for the pain?
It hurts more when I try to bend or I sit for too long.
I understand. On the contrary, is there any relieving factors?
Well, I haven't found any, but the pain is still there. Even I lay down to rest.
Even when you sleep?
Yes, I'm also sometimes awakened by the pain and I'm able to return to sleep.
Have you experienced similar events before?
Never.
Have you had any prior treatment or surgical history?
I have received the pain control medication and with the race, the pain seems to improve. However, recently, the pain can no longer affected by medication.
Okay, have you had any recent weight loss?
I have lost 5 kilos.
Have you recently experienced fever, chills, or diaphoresis?
No.
Bacterial infection?
No.
Trauma history?
No.
Other than the medication you mentioned earlier, is there any other medication used?
No.
What is your occupation?
I work at the bank as a vice secretary. For most of the work hour, I'm required to be seated. But I have to walk around the company frequently.
Is the work demanding? Are you under intense pressure?
Well, later, I have to work extra hour, but the pressure is not a big deal.
Do you have a hypertension, diabetes, or drug allergy history?
No.
Do your family have the above history?
Oh, my father has hypertension. My mother diabetes.
Okay, now I understand your situation.
May I also ask what is my likely diagnosis?
There are several reasons for your back pain. It may be simply musculoskeletal problem, which may range from your lumbar muscle overuse or strain, degenerative disease.
Any other?
Yes, like spondylolisthesis, herniated disc, or spinal stenosis, ankylosing spondylitis, tooth fracture, and it may be stained by other causes. for example, infection and cancer. I will order some tests and examinations that include blood test and spine x-ray. Yeah, and we will know more when the results of the test and the examination come in. And don't worry, I will also prescribe you some pain control medication.
Thank you so much, Dr. Lee.
I will order your checkup OPT for you.
Perfect, thank you.
Can you understand your diagnosis and my advice to you?
Yes, I understand.
Is there any additional concerns or areas that I haven't addressed clear enough?
Oh no, thank you very much, Dr. Lee. I will take medication as you advised.
Do you have any other questions?
No, thank you.
We'd better to check your drug response after 2 weeks. Can you come back then?
Yes, I will come back after 2 weeks.
Sounds great. So I'll see you in 2 weeks.
Thank you, Dr. Lee.
早安，陈小姐。
早安，林医师。医师您好，请问有什么需要填的吗？
我先请你进来，其实是有关于你先生的病况，想跟你先讨论一下，这样。
请问是有什么问题？很严重吗？
你可能要有一点点心理准备了哈，就是我们很遗憾的，因为根据这一连串的检查，你先生的这个病况其实并不是很乐观，这样。
这么严重啊？
我想问一下哦，你会希望我们用什么样的方式来告诉你先生？
可以先不要告诉他。
你现在有什么样担忧的事情吗？
最近他因为背痛啊，那心情总是很低落。我不知道他能不能承受这样的消息。
我了解你的心情啦，像我们台湾的文化，就是有时候家人会很希望说由家属来告知病人这个病况，但我想你先生他可能会比较希望我们直接的告诉他，然后他了解所有的病况。我等一下也会再告诉你先生病况的时候，稍微委婉一点点这样子。
好的，那再麻烦律师。
那等一下呢，我会请你们两个一起进来，然后一起向你先生解释一下这个病况。Hello, Steve. Please have a seat. How are you feeling today?
A lot better with the medication you have prescribed.
That's really nice to hear. Today we will explain your test result.
Okay.
Other than your wife, is there any other members of your family will be joining us?
Or just my wife is fine.
We will have approximately 15 minutes to explain the results to you. What is your understanding of the purpose with these examinations?
Well, I understand this test and result. I to know more about the past from the life of my decade. Is there any concern?
How would you like me to give you the information about the result? Would you like me to give you all the information or just sketch out the result? And then we can spend more time discussing the treatment plan.
Or just go through important results, please?
Unfortunately, I've got some bad news to tell you. With the current result, you have a lesion on your lumbar spine, which is very likely to be the bone tumor.
Is it cancer or is it malignant?
We cannot be certain yet, but with the current data, it is a very high likelihood that it is a malignant and may actually be a metastatic tumor.
How is it possible? I have always been very healthy. Why?
I know that is not what you wanted to hear. I really wish the news were better. If I were in your shoes, I will feel the very same way.
So what's the next step?
My recommendations are that we can order some more tests that include the spine MRI or the chest and GI examinations and some blood tests to rule out the potential diagnosis of a cancer. And when the results to confirm our findings, then we may move on to discuss about the treatment strategies. So Steve, can you understand your diagnosis and my advice to you?
Yes, I understand. I would like to know what would you address my backache?
We will first monitor your response to the pain control medication. But if the medication are not enough in suppressing your pain, we may have to undergo some aggressive pain control treatment, such as chemotherapy or radiation therapy, and may consider surgical intervention if it is necessary. We'd better check your exam result and the drug response after 2 weeks. Can you come back then?
Yes, I can come back after 2 weeks.
Perfect. Then I'll see you in 2 weeks.
Thank you, Dr. Lee.
There is still potential need for emergency visit in case you may have neurological symptoms.
So what kind of symptoms may I have?
For example, the sudden leg weakness, or the urine or stool incontinence.
What should I do?
You can visit our emergency room for further help, and our staff will contact me when you are in the emergency room.
I see. Thank you, Dr. Lee.
If there is no other question, I will see you in 2 weeks.
Yes, I'll see you. Thank you again, Dr. Lee.
No problem.